Welcome to the deep dive. Ever wondered what actually happens, like right after a baby's born?
Those first few minutes are pretty crucial.
Yeah, there's this quick assessment, the Apgar score. We're going to sort of unpack that today.
Exactly. It's all about understanding what those initial signs mean for a newborn's, well, immediate well-being.
So think of it like a very quick health check.
A rapid snapshot, yeah.
Yep.
Taken at 1 minute and then again at 5 minutes after birth.
Sometimes 10 minutes too, right?
Sometimes, yeah, if needed. It helps gauge how the baby's adjusting to, life outside the womb.
Okay, so the mission today is to break down each part of the score and figure out why it's so important right at that moment.
Precise.
Let's get right into it then. The Apgar score, it has 5 parts. People often use that mnemonic, right? APGAR.
That's the one. Appearance, pulse, grimace, activity, and respiration. Makes it easier to remember.
Okay, so first up, pulse. Heart rate, what's significant there?
Well, heart rate is like a really fundamental sign, super critical for seeing how the baby's cardiovascular system is kicking in.
Right.
So a score of 2, that's good. It means the heart rate's over 100 beats per minute. Strong, healthy.
And lower.
Below 100 gets a 1. And, well, an absent pulse is a 0. It really shows that basic drive,
Yeah, makes sense. Okay, next is our respiration, breathing effort. What are we listening for or looking for?
We really want to hear a good, strong cry. That vigorous crying, that gets a 2.
All right.
If it's maybe weak or irregular breathing, just gasping maybe, that scores a 1.
And a 0.
No breathing effort at all, that's a 0. That first cry is just so vital for getting the lungs working properly. Think R for robust cry, maybe.
Got it. Robust cry. Then we have A, appearance,
Right.
which is skin color.
Exactly. Skin color. Ideally, you want the baby to be pink all over. That's a score of 2. Shows good oxygen levels. But it's actually really common to see a baby who's pink in the body but has slightly bluish hands and feet. That's called acrocyanosis.
Acrocyanosis, right.
That gets a 1. Perfectly normal often, but technically scores a 1.
And if they're blue all over?
If the baby's blue or pale all over, that's cyanosis. That scores a 0 and suggests a serious lack of oxygen. Needs attention fast. So A for all pink is, well, appealing.
Okay. Color cues are key. Then G, grimace. What's that? Sounds odd.
Yeah, it does a bit. It's actually reflex irritability. It's about how the baby responds to some gentle stimulation.
Like what?
Like maybe flicking the sole of a foot or some suction in the nose.
Yeah.
A strong reaction like a cry or a sneeze or a cough, that's a 2.
Right.
If they just sort of grimace, pull a face, that's a 1.
And nothing.
No response at all is a 0. It tells us
Yeah.
about their nervous system's immediate reaction. So G for getting a reaction.
Makes sense. And the last A, activity.
Yep, activity, which is basically muscle tone.
Okay, what are we looking for there?
We want to see active movement, arms and legs flexing, moving around spontaneously, that's a 2.
Active, right.
If there's just some bending, some flexion of the limbs, but not really active movement, that's a 1.
And 0.
Limp, flaccid, no muscle tone, that gets a 0. It gives us a clue about muscle strength and neurological function. A for active.
So we've got these 5 things: pulse, respiration, appearance, grimace, activity. Each scored 0, 1, or 2.
Exactly.
Then you add them up. What do the total scores tell us?
Right. So the total can range from 0 to 10. A score of 7 to 10 is generally considered good. Reassuring means the baby's in pretty good shape.
Okay. And lower scores.
A score between 4 and 6 is moderately low. It suggests the baby might need some help, maybe some oxygen or stimulation to breathe better.
And really low, like 0 to 3.
Yeah, 0 to 3 is a very low score. That's a critical finding. It means the baby needs immediate medical help, like resuscitation.
But it's really crucial to stress, isn't it, that this is just a snapshot right then and there.
Absolutely. That's so important. The Apgar score is not a crystal ball. It doesn't predict long-term health or, developmental outcomes.
So it's purely about the immediate situation.
Purely. It's a guide for immediate care. What needs to happen right now in those first 2 minutes? It's like the first very quick conversation the medical team has about how the baby's doing.
That's a good way to put it. So just to quickly run through them again: pulse, heart rate,
Respiration, breathing effort,
appearance, skin color,
grimace, reflexes.
and activity, muscle tone.
Yeah, each one giving us a vital piece of the puzzle about the newborn's condition right at the start.
This initial check provides such critical information, doesn't it? Allowing doctors and nurses to step in quickly if needed.
It really does. Ensures the best possible start. It's pretty amazing how much you can learn in just 5 minutes.
It really is. Makes you appreciate those first few moments of life. And it makes you wonder what other situations have such a concise, vital initial assessment that tells you so much so quickly. Definitely something to think about.